Right now, as you are sitting there watching this video, your body might be trying to send you a desperate warning. A warning that is so subtle, so easily dismissed as just getting older, that millions of people completely ignore it every single year. Most of us have been taught that a heart attack is sudden. We see it in the movies and on television all the time. Someone is walking down the street or having a stressful conversation. They suddenly clutch the center of their chest. They gasp for air in agonizing pain, and they collapse to the floor. But clinical research, cardiologists, and decades of emergency room data tell us a completely different story. The absolute truth is that your heart rarely just stops working without warning. In fact, in over 80% of all documented cases, a heart attack is not a sudden event at all. It is the final, devastating stage of a process that your body has been fighting for days, weeks, and sometimes even months. What if I told you that your body starts flashing massive, undeniable warning signs 3 days, exactly 72 hours, before a massive cardiac event occurs? What if I told you that the extreme fatigue you felt yesterday, or that weird indigestion you had after dinner that wouldn't go away, wasn't just something you ate, but your heart literally begging for oxygen? Welcome to the channel. I'm Dr. Franklin Reed, and here, medical science finally speaks your language. Every week, I cut through the noise, the confusion, and the overwhelming amount of clinical research out there to bring you what actually matters. I provide clear, honest insights on your health, built specifically for adults in their 50s, 60s, 70s, and beyond. There are no fads here. There is no fear-mongering. There is just practical, evidence-informed guidance to help you feel sharper, stronger, and more in control of your life. Today, we are talking about the single biggest threat to your life after the age of 50. But we aren't just going to talk about the obvious signs like crushing chest pain. By the time you feel that crushing chest pain, the event is already happening, and precious heart muscle is already dying. Instead, I am going to show you exactly what a heart attack looks like 3 days before it hits. We are going to cover the 5 silent warnings that you absolutely must know to protect yourself. And I need you to pay incredibly close attention to warning number 4, because it is the one symptom that women in particular almost always mistake for a simple stomach bug, often with fatal consequences. Later in this video, I will also share the exact, simple, everyday protocols you can start using today to drastically drop your risk of experiencing a cardiac event in the first place. If you want to protect your heart and the hearts of the people you love, do not click away. What you learn in the next few minutes could literally save your life. Before we can truly understand the 3-day warning window, we have to completely unlearn what we think we know about heart attacks. We call it the Hollywood heart attack myth. You know exactly what I mean. The sudden, agonizing pain in the center of the chest. The left arm going completely numb. The sudden collapse. Now, do heart attacks happen this way in real life? Yes, sometimes they do. But if you are waiting for this dramatic, cinematic moment to call for an ambulance, you are playing a very dangerous game with your life. Here is the medical reality, especially for adults over the age of 50. The nerves in our bodies change as we age. Our pain receptors change. If you have any history of elevated blood sugar, prediabetes, or type 2 diabetes, which affects millions upon millions of Americans right now, your nerve endings are already slightly dulled. This is a condition called neuropathy. Because of this dulling of the nerves, you might never actually feel that classic crushing chest pain. The pain signal simply cannot travel from your heart to your brain with the same intensity as it would in a healthy 20-year-old. Instead, your heart will send distress signals through different, seemingly unrelated pathways in your body. Let us think about the plumbing of your heart for a moment. When the coronary arteries, which are the vital blood vessels that supply your heart muscle with the oxygen and nutrients it needs to beat, start to narrow dangerously, the heart has to work 10 times harder just to keep you alive. Imagine trying to breathe through a tiny coffee stirrer straw while running at full speed on a treadmill. That is exactly what your heart muscle is experiencing days before a full blockage occurs. And when your heart is starving for oxygen, it triggers a systemic alarm. It affects your stomach, your sleep patterns, your energy levels, and your entire nervous system long before the artery completely closes off. This 72-hour window is your body's grace period. It is your ultimate chance to intervene and stop a catastrophe. But you can only intervene if you know exactly what to look for. So let us break down the 5 silent signs, starting with the most common yet most frequently ignored warning of all. Warning sign number 1 is profound, unexplained fatigue. Now, I can already hear you saying, Dr. Franklin Reed, I am over 50 years old. I am tired all the time. I work hard, I take care of my family. How am I supposed to know if it is a heart attack or just a long, exhausting day? Listen to me very closely, because the difference between normal tiredness and cardiac fatigue is critical. I am not talking about the tiredness you feel after a bad night's sleep, or after chasing your grandchildren around the yard all afternoon. I am not talking about needing an extra cup of coffee at 2 in the afternoon to get through the rest of your workday. The fatigue that occurs days before a heart attack is an overwhelming, crushing exhaustion that hits you entirely out of nowhere. It is a fatigue that feels incredibly heavy, almost like you are trying to move your body through wet concrete. Patients who have survived major heart attacks often tell me the exact same story when I talk to them in recovery. They say, "Doctor, 3 days before it happened, I couldn't even find the energy to make my bed in the morning." Or they say, "I walked to the mailbox at the end of my driveway, a walk I do every single day, and I had to sit down on the curb because my legs just absolutely would not carry me back to the house." Why does this happen? When the arteries leading to your heart start to clog with plaque, which is a dangerous buildup of cholesterol, fat, calcium, and cellular waste, the blood flow is severely restricted. Your heart is the main engine of your entire body. When the engine isn't getting enough fuel, it has to prioritize where it sends the remaining blood supply. Your body is incredibly smart and heavily focused on survival. It knows that to keep your brain and your vital organs alive, it has to steal blood flow from your skeletal muscles and your limbs. As a result of this survival mechanism, your arms and legs are suddenly deprived of the oxygen they are used to getting. The simple act of lifting your arms to wash your hair in the shower suddenly feels like you are lifting a 100-pound weight. You feel an exhaustion that sleep simply does not fix. You could go to bed early, sleep for 10 solid hours, wake up the next morning, and still feel completely and utterly depleted. If you are a woman, please pay special attention to this. Extensive medical studies show that over 70% of women who experience a heart attack report extreme, unexplained fatigue in the days leading up to the event. Tragically, because they don't have chest pain, it is often misdiagnosed by doctors as depression, stress, anxiety, or the flu. Do not dismiss this symptom. If you experience a sudden, dramatic drop in your energy levels that makes your routine, everyday tasks feel impossible to complete, your heart is waving a massive red flag. But profound fatigue is usually accompanied by our second warning sign. This is one that confuses both patients and even some trained medical professionals. Warning sign number 2 is what we in the medical field call the indigestion trap. Think about how many times you have felt a burning sensation in your chest, a sour stomach, or a sudden bout of nausea, and you immediately blamed it on the spicy food you ate for lunch or the heavy, rich dinner you had the night before. You walk over to the medicine cabinet, you chew an antacid tablet or drink some pink bismuth, and you wait for the discomfort to pass. But what if that heartburn isn't coming from your stomach at all? What if it is actually coming from the lower wall of your struggling heart? The human body's nervous system is a brilliantly complex, but sometimes flawed, tangled web. The nerves that supply the lower part of your heart are located right next to the exact same nerves that supply your stomach and your esophagus. When the lower wall of your heart becomes starved for oxygen, a dangerous condition we call ischemia, it sends desperate pain signals up to your brain. But because those nerve pathways are so incredibly close together, the brain gets confused. It misinterprets the distress signal coming from the heart as a distress signal coming from the stomach. This phenomenon is called referred pain, and it is one of the deadliest biological illusions in the human body. 3 days before a major cardiac event, you might experience severe heartburn that simply does not respond to antacids, no matter how many you take. You might feel deeply nauseous or even vomit for no apparent reason when you haven't eaten anything unusual. You might feel a strange, heavy fullness, a deep pressure, or a squeezing sensation right below your rib cage in your upper abdomen. Let me tell you about a patient I once had. Let's call him Robert to protect his privacy. Robert was 62 years old and generally healthy. 2 days before his massive heart attack, he went to a local urgent care clinic complaining of what he was absolutely certain was food poisoning. He had severe stomach cramps, nausea, and a terrible burning sensation in his upper abdomen. The clinic agreed with him, gave him anti-nausea medication, and sent him home to rest. 48 hours later, Robert was in the back of an ambulance fighting for his life. The key difference between normal, everyday acid reflux and heart-related indigestion is the context in which it happens. Normal acid reflux almost always happens after you eat specific, known trigger foods, like tomatoes or fried foods, and it usually gets much worse when you lie down flat in bed. Heart-related indigestion, on the other hand, often happens completely randomly. It might happen when you are exerting yourself, like carrying heavy groceries up a flight of stairs, and then mysteriously, it goes away when you sit down and rest for a few minutes. It also might be accompanied by a sudden cold sweat, which brings us perfectly to our next critical warning sign. If you are over the age of 50 and you suddenly develop severe indigestion or heartburn out of nowhere, and your usual antacids do absolutely nothing to fix it, do not just assume it is your diet. It could very well be your heart telling you that a major, life-threatening blockage is imminent. This brings us to warning sign number 3, which is the sudden, unexplained cold sweat. We all sweat when we engage in heavy exercise or when we are out working in the hot summer sun. That is the body's perfectly normal, natural cooling mechanism doing its job. But breaking out in a cold, clammy sweat while you are just sitting calmly in your living room watching television is a massive neurological alarm bell that you cannot ignore. In the 72 hours before a heart attack, your body goes into a state of absolute high alert. Remember, your heart is struggling mightily to pump blood through blocked, hardened, and narrowed arteries. To compensate for this incredible physical stress, your body activates the sympathetic nervous system. This is your internal fight or flight response, the same system that would activate if you were being chased by a wild animal. Your brain senses that your heart, your most vital organ, is in grave danger, so it dumps a massive amount of adrenaline and cortisol directly into your bloodstream. This adrenaline surge does a few very specific things. First, it makes your heart beat faster and harder to try and force blood through the dangerous blockage. And secondly, it triggers a massive systemic sweat response across your entire body. But because your body isn't actually physically hot from exercise or the weather, the sweat feels distinctly cold and clammy on your skin. You might find yourself waking up in the middle of the night with your pajamas and your bed sheets completely soaked through. Or you might be sitting in a heavily air-conditioned room and suddenly feel a thick bead of cold sweat drip all the way down your back. Please understand, this is not a hot flash associated with menopause, and this is not a normal bodily function. This is your autonomic nervous system screaming at the top of its lungs that your cardiovascular system is under extreme, life-threatening duress. When a cold, clammy sweat happens alongside the extreme fatigue we talked about, or that strange, unyielding indigestion, you are no longer looking at random, isolated symptoms. You are looking at a terrifying puzzle coming together right in front of you. You are looking directly at the 72-hour countdown. Now we arrive at warning sign number 4. I told you at the very beginning of this video to pay extremely close attention to this one, because it is incredibly dangerous. And yet, it is almost entirely ignored by the general public and often misdiagnosed. Have you recently started waking up in the middle of the night, suddenly gasping for air, feeling completely panicked like you cannot catch your breath no matter how hard you try? Most people brush this terrifying experience off as just a bad dream, or they assume it is simply related to snoring, aging, or mild sleep apnea. But let me tell you exactly what is actually happening inside your chest when this occurs. When your heart muscle is actively weakening because of severely blocked arteries, it becomes much less efficient at pumping blood throughout your body. During the day, when you are standing or sitting up, gravity helps pull fluid down toward your legs and feet, which is why people with weak hearts often have swollen ankles. But when you lie flat on your back to go to sleep at night, gravity is no longer helping your circulation in the same way. Because the heart is too weak to pump effectively, fluid can actually start to back up into your lungs. This is a mild, early form of a condition called pulmonary edema. As this fluid slowly builds up inside the delicate air sacs of your lungs while you are sleeping, your blood oxygen levels begin to drop dangerously low. Your brain, constantly monitoring your oxygen levels, suddenly realizes that you are essentially suffocating from the inside out, so it violently forces you to wake up. You jolt awake, gasping loudly, coughing, and often feeling a tight, restrictive pressure deep inside your chest. You might find that you have to sit up on the edge of the bed for several minutes, hunched over, just to finally catch your breath and feel normal again. Listen to me very carefully. This is not just harmless snoring. This is your heart physically failing to keep the fluid out of your lungs. because it is simply too weak and starved from a lack of oxygen. This specific symptom often appears days or even weeks before a full myocardial infarction, which is the technical medical term for a heart attack. If you find that you suddenly need to sleep propped up on 2 or 3 extra pillows just to breathe comfortably through the night, or if you are jolting awake clutching your chest in a panic, you need to contact a medical professional immediately. Your body is telling you in the clearest possible terms that the internal plumbing is backing up and failing. Do not ignore the nighttime gasp. It is one of the final warnings you will get. Finally, we reach warning sign number 5. This is the symptom that tragically sends thousands of people to the dentist, the physical therapist, or the chiropractor, instead of the emergency room where they actually belong. I am talking about sudden, unexplained, and persistent pain in your jaw, your neck, or your upper back. Once again, we must return to the fascinating medical concept of referred pain. Within your body, the vagus nerve is an absolutely incredible piece of biological wiring. It connects your brain directly to your heart, your lungs, your digestive tract, and your vocal cords. It is the information superhighway of your internal organs. When the heart muscle is starving for oxygen and beginning to die, it screams out in severe pain, sending panic signals shooting up through the vagus nerve. But because the nerve pathways that service your lower jaw, your teeth, your neck, and your upper back all feed into the exact same general area of the spinal cord as the nerves from your heart, your brain gets the coordinates completely wrong. It is like a crossed wire in an electrical box. You might not feel anything in your chest at all. Your chest might feel completely fine. Instead, you might feel a dull, aching, relentless throb deep in your lower jaw that you swear is a tooth infection. You might feel like you have a sudden, incredibly stiff neck that radiates a burning sensation down into your shoulder blades. For women, this presentation is particularly prevalent and highly dangerous. Clinical studies show that women are much more likely to experience upper back pain, which they often describe as a tight, squeezing pressure right between the shoulder blades, rather than the classic left arm numbness or chest crushing that we typically see in men. Because of this, women are routinely sent home from hospitals with muscle relaxers instead of life-saving cardiac care. If you wake up with a sudden, unexplained ache in your jaw or a severe tightness in your neck that does not go away with massage, stretching, or painkillers, and it is accompanied by that profound fatigue or a sudden cold sweat we discussed earlier, that is the 72-hour warning staring you in the face. Do not go to the chiropractor to get your neck adjusted. Do not book an emergency dental appointment. You need an electrocardiogram. You need a blood test to check your troponin levels. You need your heart checked immediately. So we have thoroughly decoded the critical 72-hour warning signs: profound, crushing fatigue, unexplained, severe indigestion, clammy, cold sweats, nighttime gasping for air, and referred pain in your jaw, neck, or back. If you experience 2 or more of these symptoms simultaneously, do not wait to see if you feel better tomorrow. Call emergency services immediately. It is always better to be slightly embarrassed in the emergency room because it turned out to be nothing than to be pronounced dead in your living room because you waited too long. But what if you aren't experiencing any of these terrifying symptoms right now? What if you are feeling okay today, but you want to make absolutely sure you never ever reach that 72-hour window in the first place? This is where you have the power to take back control of your health and change your destiny. The arterial plaque that clogs your blood vessels and ultimately causes heart attacks does not just form overnight. It is not bad luck. It is the cumulative result of years and decades of chronic inflammation, high blood sugar spikes, and severe oxidative stress within your body. To protect yourself starting today, right now, you must implement what I call the Vascular Defense Protocol. This is a simple 3-step system designed to clean your arteries, lower inflammation, and strengthen your heart muscle. Step 1 of the Vascular Defense Protocol is to completely cut out the hidden sugars from your daily routine. For decades, we were told that eating fat is what clogs our arteries. We were told to eat low-fat everything. But modern clinical research has proven that this was a massive mistake. It isn't just the fat in your diet that clogs your arteries. It is the refined, processed processed sugar. Sugar causes massive, immediate inflammation in your blood vessels. When you consume high amounts of sugar, it acts exactly like coarse sandpaper rubbing against the delicate, smooth inner lining of your arteries. This lining is called the endothelium. When that delicate lining is scratched and damaged by sugar, your body sends cholesterol rushing in to act like a bandage to patch up those microscopic cuts. Over time, as you consume more sugar and create more damage, more and more cholesterol builds up to patch the wounds, forming the very hardened plaque that eventually ruptures and leads to a massive heart attack. If you want to save your heart, you must eliminate sugary sodas, refined white breads, pastries, and highly processed packaged snacks. You have to stop scratching the inside of your blood vessels. Step 2 of the protocol is to actively introduce nitric oxide boosters into your daily diet. Nitric oxide is nothing short of a miracle molecule that is naturally produced by your own body. Its primary job is to tell your blood vessels to relax, to open up wide, and to lower your overall blood pressure, allowing oxygen-rich blood to flow freely to your heart and your brain. However, as we age, and particularly after the age of 50, your body's natural production of nitric oxide plummets dramatically. Your blood vessels become stiffer and more rigid, but you can naturally restore this vital molecule by eating foods that are incredibly rich in dietary nitrates. I'm talking about deep red beets, fresh spinach, arugula, kale, and garlic. Eating a large, robust serving of these specific greens every single day literally forces your arteries to dilate and expand, significantly improving blood flow and taking a massive amount of workload off of your aging heart. It is like opening up a clogged highway so the traffic can finally flow freely. Step 3 is perhaps the most important and easiest to implement: the 15-minute post-meal walk. Remember just a moment ago how we talked about blood sugar acting like dangerous sandpaper on your arteries? The absolute highest spike in your blood sugar happens exactly 45 minutes after you finish eating a meal, especially a meal heavy in carbohydrates. If you finish your dinner and immediately sit down on the couch to watch television for the rest of the evening, that massive surge of sugar stays trapped in your bloodstream, circulating around and causing severe damage to your vascular system. But if you simply stand up, put your shoes on, and take a brisk 15-minute walk immediately after eating, something incredible happens. Your large leg muscles will instantly soak up that excess sugar to use it as fuel for the walk. This prevents the sugar from ever spiking in your bloodstream, entirely preventing the vascular damage before it even starts. It is one of the most powerful, completely free health hacks in the entire world, and it requires no medication whatsoever. Your heart is a truly miraculous machine. It beats over 100,000 times a day, every single day of your entire life, never taking a break, never asking for a vacation. It asks for nothing in return but a little bit of care, a little bit of respect, and the right fuel to keep going. It is never too late to start repairing the damage. It is never too late to change the course of your health. Listen to the subtle warnings your body gives you. Protect your delicate arteries by cutting the sugar and increasing your movement. And take back control of your health today, so you can be there tomorrow for the people who love and depend on you. If you found this information valuable, please share this video with someone you love. Send it to your parents, your siblings, your friends. It could be the very thing that saves their life when they least expect it. Subscribe to the channel for more evidence-based, no-nonsense health guidance. All content provided here is for educational purposes only and does absolutely not constitute medical advice. You must always consult your personal physician before making any changes to your diet, your exercise, or your health routine. This content is produced with the assistance of advanced AI technology to ensure accuracy and clarity. I am Dr. Franklin Reed. Stay sharp, stay strong, keep moving, and I will see you in the next video.